Hi, everybody. This is Dr. Brett Talley Daniel, MD, a neurologist and headache doctor, and today I'm podcasting on the subject of who gets medication overuse headache. Well, medication overuse headache occurs in persons who overtreat their headaches with medication more than 2 or 3 days a week. If simple analgesics like Tylenol or Advil are used, it takes 15 days a month for chronic daily headaches to occur. If opiate narcotics, butalbital, or triptan is used, it takes only 10 days of medication use to develop daily or near-daily headaches. The preferred term is medication overuse headache, abbreviated as MOH, but it used to be called rebound headache. Taking the painkiller helps the headache a little, and then it rebounds back. The headache victim takes some more medication, and the headache continues. It's a bad cycle. Many persons with migraine develop medication overuse headache from overtreatment. Sometimes persons with tension-type headache get the same thing. Migraine is an episodic disorder with headache pain defined as lasting 4 to 72 hours only. Persons with medication overuse headache have daily or near-daily mild to moderate headaches. Many persons who have migraine or a family history of migraine develop chronic migraine, which is defined as 15 headache days per month, 8 of which have migraine features of being severe, throbbing, one-sided, and associated with nausea and vomiting and sensitivity to light and sound. About 90% of persons with chronic migraine who also have a diagnosis of medication overuse headache. They go together. The cause of the headache, the remaining 10% of patients with chronic migraine is basically uncertain. Medication overuse headache occurs in about 3 to 4% of the world population, but chronic migraine occurs in 1 to 2%. Headache clinics have 80-90% incidence of medication overuse headache in new patients. Certain relationships are associated with medication overuse headache, which are discussed here. However, explaining why these exist is difficult and poorly understood. So the question is, who gets medication overuse headache? Persons with migraine, a family history of migraine, or tension-type headache, or who overtreat with headache medicines get medication overuse headache. Other features are that medication overuse headache occurs in Caucasian background, female sex, lower education, previous marriage, overweight, obstructive sleep apnea, frequent caffeine use, stressful life in the previous year, head injury, persons with high baseline headache frequency, persons who overuse medication, comorbid depression, and smoking. So I'm going to individually discuss those associated issues. That's who gets medication overuse headache. All right, many socioeconomic and psychosocial issues are associated with medication overuse headache. It's hard to tell if these are direct or indirect findings. These factors may just be markers of how chronic headache affects a complex situation. Articles written in the headache literature report that the features listed here are associated with medication overuse headache. These features in person with migraine and medication overuse headache are not diagnostic of anything particularly, but they are statistically correlated. The associated issues with medication overuse headache discussed here are as I've listed above. So the first is Caucasian background. It's a known statistical feature which is poorly understood. One study of patients with medication overuse headache had a total sample studied of 2,107, out of which 17%, or 36 patients, were non-Caucasian, and 82%, that is 1,736 headache patients, were Caucasian. Whether education, profession, economic status, or other factors were responsible is not certain. Female sex. Well, this is easier to understand because women have 3 times more migraine than men, but why women have so much migraine is not fully understood. The American Migraine Study of 100,000 persons found 25% of women had migraine maxing out at age 42 years old, while 6% of men had migraine peaking at 28 years of age. Whether it's estrogen hormones, some genetic issue, or stress level, women have more migraine than men and therefore overtreat and get more medication overuse headache. Also, migraine depression are 50% comorbid. Comorbid means that the two medical problems occur more commonly than by chance. Women have more depression and psychiatric disease than men. Migraine and generalized anxiety disorder and panic disorder are comorbid, and 40% of the time, women have an increased tendency to treat pain with medication. Number 3, lower education. People with medication overuse headache have lower income with more irregular employment and problems providing medical insurance. It may have to do with increased stress and lower insurance coverage, resulting in an increase in the use of over-the-counter medicines to treat migraine. Research studies have found that more patients who take triptans for treatment of migraine have a reduced incidence of medication overuse headache, but a person usually has to have had insurance to see the doctor and to buy the triptan medication. Lower education jobs may be physically more intense also and more outside working in the cold or the heat environments, which may aggravate migraine occurrence also. Number 4, previous marriage. This is another sociological issue. Divorce is extremely stressful for persons who go through it, and stress of that may last 2 to 3 years. There's also child care issues, place of living changes due to house sales after property settlement, job losses, and economic changes due to payment for alimony, lawyers, and court costs. Number 5, overweight. Overweight persons don't exercise well, and exercise is a powerful stress-reducing activity that raises endorphins, internal analgesic chemicals that help pain and give a good night's sleep. The American Heart Association recommends that everyone, all ages, exercise aerobically 3 or 4 days a week for 20 to 30 minutes. Aerobic exercise increases the heart rate. Examples are jogging, swimming, cycling, rowing, treadmill, or an elliptical machine. Obesity has an increase in psychiatric factors as well, such as depression and anxiety, and persons with anxiety and headache end up overtreating with painkillers as they nervously try to get rid of their headache. Number 6, obstructive sleep apnea. Obstructive sleep apnea may have an increased risk of myocardial infarction, heart attack, or stroke. Obstructive sleep apnea and medication overuse headache are comorbid. Symptoms of obstructive sleep apnea are hypersomnia, it means they sleep a lot, tendency to fall asleep during the daytime, swatches while driving, reading, watching movies or TV. They have snoring noise produced by compromised air travel during their sleep, and they also have sleep apnea, it means they quit breathing. Apnea is observance by bed partner that the patient stops breathing during the night. Obstructive sleep apnea occurrence is closely tied to overweight and can be treated by weight loss. Number 6, frequent caffeine use. The American Headache Society has said that the number 1 drug that drives medication overuse headache is caffeine. Caffeine is a drug. It has pharmacological properties of promoting cerebral alertness and vasoconstriction of cerebral arteries. Caffeine is a weak drug for treating migraine by causing vasoconstriction to the vasodilated artery caused by the migraine process. The general public is confused about caffeine. It's true that taken with a limitation of no more than 2 days a week as treatment of migraine headaches, caffeine is helpful. And for some person, when Coca-Cola was introduced in the 19th century by pharmacists in Georgia, it was advertised over the counter at drugstores as a treatment for migraine. The soft drinks that are caffeinated are Coke, Dr. Pepper, Pepsi, Mountain Dew. The amount of caffeine in those is about 35 to 55 milligrams. Homebrew coffee, like Folgers, has 8 ounces, has 135 milligrams of caffeine, while Starbucks, 250 milligrams has in 8 ounces. I've got a lot of that listed in my blog article if you want to read about that. I have an article called Caffeine is a Drug there also. Excedrin is commonly used over the counter to treat migraine. It has 65 milligrams of caffeine and 325 milligrams of aspirin. The problem is that the migraine process releases inflammatory chemicals in the brain that last 3 days. Taking more than 2 days of caffeine causes continued release of the inflammatory chemicals and the development of medication overuse headache. Number 7, stressful life event in the previous year. This factor relates again to anxiety, insomnia, and depression stemming from some stressful event. The stressful event could be job loss, change of living location, divorce, childbirth, loss of close family member, retirement, or major change in health. Migraine has many triggers, such as food that you eat or don't eat, estrogen changes, insomnia, red wine, barometric pressure change, but always the number one issue that drives migraine is stress. Number 8, head injury. The International Classification of Headache Disorders number 3, which is the Bible for headache diagnosis for the world, has an entry called headache attributed to trauma or injury to the head and or neck. The main problem here is the patient with head injury has migraine. Migraine occurs in 25% of women and 6% of men. Persons with migraine fare poorly with head injuries. Then it depends on the type of head injury. It could be a mild, non-concussive head injury, a concussion, cerebral trauma with penetrating head injury, cerebral trauma with non-penetrating head injury, or cerebral contusion. The diagnosis of concussion has been stressed the past few years as a worry for NFL football players or even young kids playing middle school football. A concussion is a head injury associated with either brief, like 2 to 5 minutes, loss of consciousness of a head, or a head injury associated with short-term amnesia for current events. Cerebral contusion denotes a more severe, harder impacting head injury with loss of consciousness, even developing coma, and associated with bruising or tiny dot hemorrhages in the brain on CT scan or MRI scan. Such injuries are occurring and oftentimes life-changing, but the worst part of it is that the doctor or nurse or mother overtreats the patient with opioid narcotics, butalbital, or over-the-counter drugs like caffeine, NSAIDs, which are like Advil or Aleve, or Tylenol. Then, if too much medication is given, the patient will develop medication overuse headache, which can last for months to years. I've personally seen many such patients who sustained a mild concussion with brief loss of consciousness, had a normal neurologic exam and imaging, who then went on to have disabling severe headaches for months afterwards. Oftentimes, when I review the patient's previous medical records, the patient has been given hydrocodone or Fiorinol or 800 milligrams of ibuprofen to take multiple times a day on hospital discharge, and that's the real cause for the long headache period, medication overuse headache, not the original concussion. There have been many reports in the neurology literature through the years of United States servicemen who had head injuries in combat and then sustained long, disabling periods of headaches lasting years or months. I always search those articles closely because I want to see if the author documented the treatment our battle heroes were given. However, many times the treatment given is not mentioned, and so to me the report is incomplete and really useless when trying to study the reported head injury. Many of these papers have been written by general medical doctors or orthopedists who unfortunately are not trained in headache. It's still amazing for me to see patients in my office in Dallas who've been given inappropriate headache treatment by pain doctors, primary care doctors who don't know anything about medication overuse headache. I saw a young migraine nurse several weeks ago who had been taking Fioricet 3 to 6 pills a day for 10 years and has had daily severe headaches from it. I volunteered to join the Navy at the end of the Vietnam conflict. Was lieutenant commander in the neurology department of Balboa Hospital in San Diego, California, from 1974 till 1976, and I saw many injured Navy personnel fresh off the boat from Westpac, which is Navy talk for Vietnam. Unfortunately, 74 was before the world knew about 1974, before medication overuse headache was well known and was not well described in neurology literature until about 1991. 9. High baseline headache frequency. The problem here is that only migraine patients release inflammatory neurochemicals, neurokinin A, substance P, and CGRP, in the brain that are part of the migraine timing cycle. So 75% of women and 94% of men don't release these neurochemicals, so they don't usually get daily headaches if they drink lots of coffee every day or use Advil, Tylenol, or Aleve frequently. The majority of medication overuse headache patients have migraine, but there's also a poorly understood inherited genetic quality, so it's thought that not every migraine patient will get medication overuse headache, only certain ones. We don't understand. It's probably a genetic thing. The way doctors know them is that they eventually show up at the doctor's office with severe disabling headaches with migraine features and with a history of frequently taking a lot of painkillers. Metabolism of the inflammatory chemicals occurs so that the chemicals are released in the brain by the ganglia of the cerebral arteries, and the trigeminal nerve. The chemicals leave the brain through the cerebral veins, are metabolized in the liver, and eventually end up in the toilet after about 3 days. That's why migraine can last 4 to 72 hours. 72 hours is 3 days. The definition of episodic migraine, as long as 4 to 72 hours, is not some abstract time period made up by a headache committee out of medical school. 72 hours is the real, continuously observed and charted period of time a migraine lasts. That's just the way it is. It's a poorly understood scientifically exactly what happens when a drug like caffeine is consumed by a migraine patient, and suddenly, usually after several days, caffeine doesn't help treat the migraine by causing vasoconstriction of a dilated cerebral artery. But what happens is, with continued presentation of caffeine, the brain releases the neurochemicals continuously, and the headache, which started Monday, starts lingering up by Wednesday, and then after that, every time the patient takes the caffeine, which could be Excedrin, Starbucks, Grande Venti, the brain releases another load of neurochemicals. The headache lasts till Thursday. The caffeine comes again. The headaches last till Friday, and so on. This is called transformation from episodic to chronic migraine headache. I tell patients using caffeine as an example to tell a story, but it could be any painkiller such as Advil, Tylenol, Aleve, any other NSAIDs, opiate narcotics, triptans, or butalbital. That overtreating with caffeine is like putting kerosene on a wood fire that just keeps burning as long as there's wood and kerosene. I compare medication overuse headache to diaper rash. I know this is a dirty job. I'm the father of 5 kids. The baby has loose stools with diarrhea from some virus they got at school. Stool in the colon is where it's supposed to be, but the bowel can handle it there. But when it gets to the baby's buttocks, then it causes inflammation and redness and pain. The mother will clean up the baby to put cortisone cream on the baby's bottom to soothe the inflammation. I know this is gross, but it makes the point and is similar to what goes on in the head of a migraine patient who overtreats and gets daily headaches. The cortisone treatment here done by headache doctors, many times given a week of prednisone, will be given while they detox their patients. So high baseline headache frequency is usually medication overuse headache. Number 10, overusing medication. This has been explained. I want to make a plea for TV, newspaper, magazine ads for over-the-counter painkillers like Tylenol, for example. Most persons I talk to know that Tylenol can damage their liver and causes liver enzyme elevation because the FDA has required the makers of Tylenol to announce this potential side effect, but the patient never been heard that Tylenol can cause daily headaches. I don't know for sure, but I bet that medication overuse headache is a more frequent side effect of Tylenol than liver trouble, and I hope the FDA in the future will educate more people about this. Also, as I've said before, caffeine's the number 1 drug in America you get medication headache on, but in Germany it is Tylenol. Number 11, comorbid depression. Migraine and depression are 50% comorbid, which means they come together clinically more frequently than by chance. Brain serotonin levels are decreased with depression, and drugs called SSRIs, which means selective serotonin receptor inhibitors, are commonly used in the practice of medicine to treat depression. Migrainists also have decreased levels of serotonin, and serotonin receptors are found on trigeminal nerve and cranial vessels. Triptans are the most successful drugs for acute therapy of migraine, and they act on the trigeminal vascular system to work. The Mayo Clinic states that women have twice the incidence of depression. Depression links to insomnia and poor sleeping with migraine in general, and in medication overuse headache very specifically. Number 12 is smoking. Smoking is always listed as an associated factor with medication overuse headache, but the reason is not well understood. It may relate to addictive patients in whom smoking and nicotine is an addictive drug, and persons who smoke oftentimes drink alcohol, and they tend to overtreat with stuff, and it turns out to be medicine. So related questions. Number 1, addiction. Caffeine at doses of 120 milligrams a day is listed by the American Psychiatry Association as being addictive. Normal, non-headache, non-migraine, and good sleeping persons can safely take up to 400 milligrams without any serious medical problems. The migraine lifestyle calls for migraineurs to decaffeinate. In America, caffeine is the number 1 drug causing this. I said that again. Persons with generalized anxiety have higher rates of addiction to alcohol and substance use. Migraine and generalized anxiety disorder are 40% comorbid, and this may be another factor linking migraine with caffeine and other addictive drugs. Medication overuse headache occurs in families that have a history of substance abuse and medication overuse headache. Behavioral therapy can change the addictive mindset from the I have pain, I'll take a tablet, to other less harmful ways of treating headache. Before the advent of triptan therapy for migraine in 1991, ergotamine was commonly used with acute therapy of migraine and caused a substantial amount of medication-overuse headache in migraine patients. That era is over, and triptan is the most common cause of medication-overuse headache in patients who have prescribed drugs. Caffeine is still a very common cause of medication-overuse headache in patients using over-the-counter therapy. One study for the European Experience of Over-Treatment found the mean duration of overuse with triptans is 17 years. For ergotamine, 1.7 years. For ergotamine is 2.7 years, and for simple analgesics is 4.8 years. That's how long they overtreat. Prevalence. The prevalence of medication-overuse headache in the general population is 1 to 2%. The male-female ratio is 1.3 to 4, and medication-overuse headache is the most prevalent at 30 to 40 years old, and the incidence of migraine decreases with aging. In Taiwan, the prevalence of medication-overuse headache in people over 65 was 1.0%. In children and adolescents, the prevalence of medication-overuse headache has been suggested to be 0.3 to 0.5%. Medication overuse headache usually starts earlier in life than other types of chronic headache. Major public health concern. Headache disorders in general, and medication-overuse headache in particular, are a major public health concern, considering the large amounts of disability and financial costs borne both to the affected person and to our society in general. Medication-overuse headache causes millions of days of missed work, chronic disability, and expenses for neurologic examination, seeing the doctor, testing with general lab, and specialty imaging such as CT and MRI. The expense of medication, making migraine the 5th most common cause of medical disability in the world. Migraine is the 10th most frequent reason for a visit to the emergency room. Migraine is present in 25% of women in the world, and for women is the most common medical problem. Okay, well, that ends my talk here on who gets medication-overuse headache. Hope it's helpful. Please click subscribe down there so we can follow each other, and look for me for other Podbean lectures that I have on migraine, and I will see you guys on the next talk.